Lit up tonight in blue for the workers of the MTA who keep the buses and rails moving through the mostly stay-at-home city of New York. Well, good evening once again. Day 1196 of this Trump administration. 188 days now until our presidential election. And on this day, spoken out loud to reporters in the White House, the president said this, and we quote, "This is going away. I think we're going to come up with vaccines and all, but this is going away. It's going to go, it's going to leave, it's going to be gone, it's going to be eradicated." Indeed, the president's son-in-law, as you'll see here in just a moment today, called what we are living through a great success story. For that, today, his proud father-in-law called him a genius. The president said we'll soon see some astonishing testing numbers, and he quickly followed that up with, "I don't know if that is even necessary." But as we start off by diving back into the real world tonight, we find the U.S. death toll stands at over 60,000 Americans. Last night here, we reported the number of dead now exceeded the total number of American losses in 19 years of fighting in the Vietnam War. And if it helps, the number of dead also equals the population of these American cities: Grand Junction, Colorado; Terre Haute, Indiana; Cupertino, California; Pontiac, Michigan; Casper, Wyoming; Chapel Hill, North Carolina. Picture all the people gone from any one of those cities. That's our death toll so far. We're also learning that new CDC data is indicating the virus could be responsible for far more infections, far more deaths than first thought. And yet there is also a sign of progress in the battle to find a treatment. As I know you've seen during the coverage today, there's new evidence that an antiviral drug actually helps patients recover from the virus. Today, the nation's top infectious disease expert, Dr. Fauci, was cautiously optimistic about this development.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. The FDA, literally as we speak, is working with Gilead to figure out mechanisms to make this easily available to those who need it.
And late today, Trump said he wants to see the Food and Drug Administration put this medication on fast track to approval.
I want them to go as quickly as they can. Stephen Hahn, Dr. Hahn, has been incredible at the FDA. He's getting things done at record time. There's never been anything like it. And yeah, we want everything to be safe, but we would like to see very quick approvals.
Trump's effort to contain the growing toll on our nation comes as he also attempts to secure a second term in office. Tonight, the Washington Post has new reporting on the challenges for the president and on the impact of weeks of marathon briefings on the polls. The paper says recent internal polling shows him slipping behind Joe Biden in some key swing states, and that he erupted during a call with his 2020 campaign manager after hearing that news. Quote, "At one point in that call, Trump said he might sue Brad Parscale. Trump told Parscale he did not believe the polling that had been presented to him, even though it came from the campaign and the RNC." NBC News now has confirmed Trump's blow-up. The AP has new details on this story as well. We will have those for you from the reporter later on in this broadcast. Today, Trump revealed he's planning to visit 2 swing states soon.
I think I'm going to Arizona next week, and we look forward to that. And I'm going to, I hope, Ohio very soon. And we're going to start to move around, and hopefully in the not-too-distant future, we'll have some massive rallies, and people will be sitting next to each other. I can't imagine a rally where you have every 4th seat full. Every 6 seats are empty for every one that you have full. That wouldn't look too good. No, I hope that we're going to be able to do some good old-fashioned 25,000 person rallies.
Do you expect to be able to hold rallies before the election? Do you think
hope so. I hope so.
One other key battleground state, Florida, announced it would begin lifting stay-at-home orders on Monday. However, that won't be the case for Miami-Dade, Broward, or Palm Beach counties where the pandemic has hit hardest. Worth noting here, and this is important, none of the states that have reopened have come anywhere close to the federally recommended decline in cases over a 14-day period. Perhaps you remember that big rollout. Also, the White House has no plans to extend its 30 days to stop the spread social distancing guidelines once they expire tomorrow.
The current guidelines, I think you can say, are very much incorporated in the guidance that we're giving states to open up America again.
They'll be fading out because now the governors are doing it. They're getting it going. And we're opening our country again.
Even amid the patchwork of approaches to reopening, most experts agree we are far short of where we need to be on testing. Trump yesterday said we'd be able to scale up testing to a level many believe is necessary to reopen the economy.
Some health experts say the U.S. needs 5 million tests per day by June in order to safely reopen. You unveiled a plan yesterday that will increase testing, but not by that much. Why not? And can you get to that benchmark?
We are way ahead on testing. We are the best in the world on testing.
You're confident you can surpass 5 million tests per day? Is that?
Oh, well, we're going to be there very soon.
We have done close to 6 million tests, period, as of today. But officials overseeing testing on the White House task force quickly told Time magazine, quote, "There is absolutely no way on Earth, on this planet or any other planet, that we can do 5 million tests a day." Then today, the president tried to insist he didn't say what we just in that clip heard him say.
Yesterday, you said that we will very soon be testing 5 million people.
Well, I don't know where
doing
it
5
came
million.
up.
When you said that,
everyone kept saying you said there'd be 5. That was a study that came out. Somebody came out with a study of 5 million people. Do I think we will? I think we will, but I never said it. I didn't say 5 million.
Today, we also learned that the economic implosion caused by the coronavirus pandemic triggered the biggest drop in gross domestic product in the first quarter since 2008. Consider that as you listen to this just this morning on Fox News from Jared Kushner.
We're on the other side of the medical aspect of this, and I think that we've achieved all the different milestones that are needed. So the federal government rose to the challenge, and this is a great success story. I think what you'll see in May, as the states are reopening now, is May will be a transition month. I think you'll see by June a lot of the country should be back to normal, and the hope is that by July the country's really rocking again.
There was also this, 2 very different versions of what's in store for our nation's economy and the 26 million people that we know of that have filed after losing their jobs.
I think the economy is going to suffer through very bad numbers. It's going to sink further. The contraction in the second quarter is going to be much deeper than the first quarter. The unemployment rate is going to go up quite a bit.
I think there's a tremendous feeling of optimism in this country, but it's a very transitional period. I think it's going to do good, but I think the fourth quarter is going to be fantastic.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.